Hi, this is John Kanellopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center and Clinical Professional Ophthalmology at NYU Medical School in New York City, New York. We're looking at a young patient, 18 years old, who had undergone Athens protocol CXL in both of the eyes. We're seeing a little bit of the laser arc scarring. He didn't protect the eyes much of UV light post-op, but the center is relatively good. He is a 20/25 uncorrected from this eye. He's 20/40 uncorrected from the other eye, some slight CXL haze. But the good side of the story is that this is this young gentleman prior to the procedure. We can all see the significant cone, minimal thickness 410. So we're on the verge of discussing a cornea transplant here on the left eye. And this is him today. And this is the left eye that we saw before. This is the normalization, and only with Athens protocol we can get a steepening in the superior flattened area of 10 diopters, flattening of 10 diopters. So we have a 20 diopter normalization from before to after in this young gentleman. And we're gonna go see the same images in the right eye, the pre-op of the right eye in January of 24. The imaging today, we're in July, so 6 months later. And what we have gained in summary in the right eye. And we're seeing almost 7 diopter flattening of the cone, a little bit over 7 diopter steepening in the flattened superior area of the cone. So 14 diopter difference. Remember here in the Athens protocol, we do very little laser intervention. So we treated probably 1 or 2 diopters of myopia and astigmatism. Proof of the pudding, left eye, we're seeing that the epithelium is almost normal. It's not, we expect all this to become green. This is the outome. We can still see the thinnest part of the cornea that we thinned a little bit more with the cross-linking. But now this area is green in the epithelial maps, which shows there's no active keratoconus. And we're seeing here our cross-linking line that's very deep and in great width. And we can tell that the anterior surface is reshaped. The cone is evident in the posterior surface. And I will close, this is the left eye with the same images on the right eye. Again, a deep cross-linking line here. And the epithelium far better in the right eye, almost all green. And again, remember what we talked about when we presented, the thinnest part of the cornea, which we thinned a little bit more with the Athens protocol. Now the epithelium here is green and not blue, showing stability. This along with the deep cross-linking line. A little bit of haze here, but this patient is exuberant. He was best corrected 20/40. He's uncorrected now with both eyes, almost 20/20. An 18-year-old, which if we had not intervened with the Athens protocol, would probably require cornea transplant by now, as his keratoconus had progressed rapidly. I'm leaving you with the last images. And again, our hello from Athens, Greece, and results like this really make us very happy and proud that we introduced this treatment for keratoconus back in 2004. It's almost 20 years now. And proof in the pudding, the fact that back then I did 120, 130 cornea transplants for keratoconus. I'm under 5 a year now. Besides the fact that I see almost 4 or 5 times the number of patients. John Kanellopoulos from Athens, Greece, signing out with these fantastic images before, after, and the difference maps. Thanks so much.